So hello and welcome to Itentive Healthcare Solutions webinar. Today we are presenting Improving NextGen Efficiencies with Itentive Products and Services, including Patient Portal Auto Enrollment, Unapplied Utility, and iCare Server Health. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for Itentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with Itentive, I wanted to share a bit of who we are with you. We've been in business as Itentive since 2003, but we've been NextGen users since 1997 EPM version 2.3. We specialize specifically in NextGen Healthcare. Our development team knows how to get data into, out of, and around NextGen to customize it and tailor it to meet our clients' unique needs. Our purpose in life is to create delighted clients by helping them get the absolute most out of their NextGen software investment. It is our passion to provide solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. We really do everything NextGen, from consulting to hosting to customization to support, and we have two NextGen add-on productivity solutions, ChartGuard and Refund Manager. We're here to help. Next, I wanted to bring your attention to some upcoming webinars. First, HIPAA-compliant texting, the do's and don'ts, on June 22nd. In it, we'll provide our viewers with best practices for achieving HIPAA-compliant texting and explore a thoughtful approach to integrating mobile technology in your practice. Specifically, we'll look at organizational policies to put in place, key product features to look for, and best practices following integration. After that, we're going to be presenting a three-part series in our federal security initiatives where we will explore the true impact they can have on your practice. Keep your eyes out for emailed invitations to these. Okay, so going back to our current webinar. At the end of the presentation, we're going to open the floor up to questions from you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. And for your reference, we'll also be emailing out links to the recordings and PDF of the presentation later this week, as we do with every webinar. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. So without further delay, I'd like to introduce our presenters for today. Jeannie Logue, Keith Justice, and Cindy Kincaid. Keith has been with Itentive for the last 4 years as our Director of Business Development. Before that, he was Vice President of a consulting services and an IT company that specialized in healthcare, so he's been in the industry for quite a while now. Many of you have probably met Keith at different NextGen events throughout the years. Cindy Kincaid is Vice President of Consulting Services at Itentive and a Certified Practice Management Executive. With over 25 years in healthcare IT industry and 9 with Itentive, her experience runs wide and deep. This makes it possible for her to provide the insights needed to help healthcare organizations experience great success, no matter what the challenge is. And Jeannie Logue has been in the industry for over 25 years and is Director of Consulting Services at Itentive and is one of our leading experts. You've likely heard her speak either on previous webinars or in person at UGMs and MGMAs. She has worked here for over 3 years and lives and breathes the industry, travels across the country seemingly nonstop, working with our clients at their locations. She's a NextGen expert and will be here to help answer questions as well. Okay, so Cindy, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Okay, thank you everyone for joining. I want to talk to you a little bit about what we're going to be doing today. It's improving NextGen efficiencies with Itentive services. We're going to be looking at the Patient Portal Auto Enrollment, Unapplied Utility, and iCare Server Health. So during the agenda of today's webinar, we're going to talk about the Patient Portal Auto Enrollment scripting, Unapplied Utilities, key features in your Unapplied report, iCare Server Health, how it works, why we build it, and then we'll end with a brief Itentive overview and questions. So first of all, we're going to talk about the Portal Auto Enrollment scripting. So what exactly is Auto Enrollment? Auto Enrollment is a plugin that automatically enrolls a practice's patients into NextGen's Patient Portal. It is also known as the NextGen Bulk Enrollment Utility. Now, you have Auto Enrollment. Everyone can have it. It's a feature that NextGen offers, but you have to have a script to be able to utilize auto-enrollment. We'll talk a little bit about more of that as we go through it. So why would you want to do auto-enrollment? The patient does not have to complete registration documents in the office. This can be done prior to the visit online. You want to get the information. They are automatically considered enrolled by bypassing the pending stage, so information can be sent right away instead of waiting for the patient to log on for the first time. I don't know if everyone on the call has the portal, or if you're thinking about using the portal, or if you're just struggling with getting patient adoption of the portal, because really what you have to do is you have those tokens, and those tokens can be a challenge. They maybe can't be avoided altogether, but they are a challenge, and getting the patients to use them, getting them to keep from losing it. I apologize, the screen just went haywire. I'm in a hotel, so bear with me. Did everyone for anyone that's on here, did the screen change for all of you?
Yes, it did, Cindy. If you could just show the presentation again, it should work.
Yeah, I don't know what happened, so I'm working on it.
Looks better. You're all
okay,
set.
are we? All right, yep. Thank you very much. So basically, I was trying to hide my control panel. That doesn't work on my laptop at a hotel. So I apologize for the delay. At any rate, back to why auto-enrollment. So basically, it gives you the need to greatly reduce the tokens that can be used to transfer all of your non-NextGen patients that currently use another patient portal. So if any of you have a portal and you want to use the NextGen, it's a method to mass enroll patient portal patients. It greatly reduces the needs for tokens, as we talked about, and it improves patient participation because they don't have to be reminded to keep that token in. And it also actually reduces support because in many cases, once you've given that token, they're calling you, they've lost it, they tried to log in, they can't use it, and it's been a great frustration for individuals. Okay, so what do you need to move forward with auto-enrollment? You need a definition of what you're going to do. You need a script, and then you want to have your rules in place, and then you want to have a test plan. And we'll talk to you a little bit about how all of those items. So as we move forward, we'll talk a little bit about the sample services and how it works. I'm going to skim through these because I don't want to take all of your time. You're going to get the slides, and what this will let you do is it will let you see what's involved and how we do it. So first of all, it's a daily back-end SQL job to calculate the patient's age and then apply the predefined business rules to enroll or unenroll the person from the patient portal. So basically, we create the script that will be based on criteria that you give us. So the enrollment script to select patients have a valid patient name, perhaps a date of birth, address, and email, and in this particular case, we can do this are less than 12 or 18 plus years old and are not currently enrolled in the portal. So we look for patients between the age of 12 and they're less than 12 and over 18 so that we're not getting into the minor patient issues, and that's the initial script and the standards that we've done. We've had groups that have done very different scripts. We've had groups that says, I want all of my patients enrolled and we're going to manage the minor rules ourselves. We've had groups that have said we don't want anyone that are minor. So we've had people who've had all kinds of different scenarios. They're saying that they don't want the patients under 12, so they don't want anyone that's over except those patients that are over 18. So the flexibility is yours. We've also created unenrollment scripts for those of you who do want to enroll your minor patients for the parents that will actually unenroll the patients as soon as they hit the age of 12, and then we'll re-enroll them when they hit the age of 18 once again. So this is an actual added incentive to take care of those minor rules. We've developed SQL scripts to generate username, password, and security answers because once you send that out, if you think about it, if you've enrolled yourself in the portal, you have to put in your username, your password, you have to create your security answer. So we can come up with defaults that you will send out as we are enrolling those, and that's all part of the scripting. Then we create the SQL script to populate the auto-enrollment tables and populate the chart user-defined fields that may be used in a printable form. So this is an optional service that we've done. So let's say that you are going to give the patients the token. There's no token, so you let them know they're being auto-enrolled, but you can actually give them a reminder sheet that they can take with them so that they don't have to remember what you're telling them or how they can do it. Then we also develop an auto-enrollment, unenrollment SQL logging process to stop enrollment records for reporting and support. So this is also an optional service. So these are just sample services that we've done. The scripts in the end, as part of this service, we will have a kickoff call with you, and we'll actually take you through what you can do. In addition, we've got additional options that have been made available. So we can make a request for additional logic to separate person and groups. We can give you enrollment reports. And we can also make a request for specifics for usernames, passwords, or other security information. So typically we'll have a default that we do, but some of them say that, you know, we want to have a little bit more security depending on the logic, and we can add additional criteria, and we're making in these requests for the usernames, passwords, and the other security information that you're putting in. So here are some of the requirements and decisions. First of all, you have to have the NextGen Patient Portal. You have to have communication services and other related utilities that are required for the patient portal. So you obviously have to have the portal before we can stop this. You will create a user-defined field on the person tab used to indicate that a person should be auto-enrolled, and that's an optional service. So we actually had one group that they didn't want everyone to automatically go, so when the patients checked in, they would let the patients know it was happening, and then we put our person tab and check in, and they can just go in and say, yes, this person gets enrollment, they don't. So they wanted uber control. So that was an optional option. You can also create one or more user-defined fields on the patient chart to store the following information in the patient portal login information. So you can do the username, password, and security answer. A NextGen form or label will be created, which will then include the chart-defined user fields with the security information. So that's optional, again, giving you something you can hand your patients. And you will facilitate and perform auto-enrollment, unenrollment testing, as well as a sign-off on the development services. So once this is all done, then we go into the testing plan, we put the testing, and then at the end you can sign off that the development services have been created and you're happy with this program. So that's really it as it relates to the auto-enrollment script. We have a number of clients that have used it. We can give you references on many people. I would say right now we're probably in the 20-plus clients that have actually elected to use this, and all of them have been successful in increasing their patient adoption as well as being able to move forward and being able to make their meaningful use numbers a lot easier without so much manual intervention. I know that the information that was there is kind of technical and probably not too exciting. It really is, in the end, just an automated process that will allow you to enroll patients, particularly all new patients or those patients that have not been enrolled, or even in some cases we've added additional logic to follow up on patients that were auto-enrolled but never actually actively engaged the portal. So if you're truly looking at patient engagement, we can even take it a little further than is defined in these slides. So now I'm going to turn it over to talk about the Unapplied Utility, and Jeannie Logue will be taking over and sharing with the work we've done on this particular program.
Actually, Cindy, right before we get to that, we had a question that we thought now would be a great time to answer as it applies to the patient portal. Somebody asked, I noticed that it generates a username and password for the patient, but at some point will the patient have the ability to choose their own username?
Yes, they will. They can always correct and change that, although typically we'll try to make one that is meaningful to them, like maybe their first initial last name, and we've had people use like the last four of the social because you can have people that qualify for that. But yes, they can make all of those changes once they go in. They're actually registered in the portal, so they can change that, they can change their password, and they can change their security question.
Okay, thanks, Cindy. And as a reminder, we will be sending out links to the recording and a copy of the slides later this week. So Jeannie, if you want to go ahead and take over and start on Unapplied Utility.
All right, thank you, Chelsea. The Unapplied Utility, one of the questions I get asked all the time, and I want you to ask yourself is, do you know how much money is out there in your Unapplied reports? Do you know how much you're collecting and putting out to Unapplied? And does your staff spend numerous hours applying these unapplied funds? So the first thing I want to talk about, though, is why do we use the unapplied? With NextGen, they have given you the ability to have your front desk collect the money, collect the copays, create their own batch, be accountable for their own batch, and then close out their batch at the end of the day. Well, those charges that they're actually going to apply this money to have not been entered into the system yet, so the unapplied actually gives them the accountability of collecting the money, balancing, and then the money goes into unapplied. And then at the time we enter the charge, we then pull the money over from unapplied, post it to the matching encounter, to the matching date of service, and everything's supposed to be clean. Well, the first thing you're going to ask yourself is, go ahead and flip a slide, Cindy. Why does the money not just currently move over? When I enter my charge, the unapplied money is supposed to, automatically move over, and we're all told that many times. But there are three really main reasons why unapplied money stays out in unapplied, even though the charge has been entered into the system. So we want to look at those three things because these are ongoing issues. You can continue to try to correct these with staff training and stuff, but this is the main reason why money sits out in unapplied and then just kind of becomes lost out there. If your charge entry staff don't open a batch or set a batch as active. So many times the charge entry staff will say, well, I'm not dealing with money. I'm not actually posting any payments, so why do I need a batch? Well, if they don't open a batch or have an active batch, then the unapplied money will not come over onto those charges once they've entered them into the system. Many times charge entry staff will start a batch in the morning, go to lunch, come back and forget to set it as active again because, again, they're only dealing with charges. They kind of forget that they need that batch to be able to move the unapplied. The second one is the encounter copayment was not entered on the insurance maintenance screen during the check-in process. This is the #1 reason why we see the unapplied not currently flow into that charge nice and smooth. You can still manually force it on that line item, but if you're not really paying attention and you don't notice that it didn't pull over, then you're basically going to leave the money out and unapplied. And I did do a quick screenshot of when I talk about the encounter maintenance. If I don't actually say the patient owes a $20 copay for today, I collect $20. When I put the charge in, all of that balance is going to sit in Insurance 1, and if it sits in Insurance 1, then the unapplied is going to say there is no balance in the patient bucket for me, so it doesn't move anything over. It doesn't know what to do with it, so it just leaves it in unapplied. And the last thing that can cause an issue, whoops, back one. The last one that can cause an issue is if my first line charge item is actually larger than is smaller than the unapplied that I collect. So if I do a post-op visit, but then the patient also has a couple of other things that I can bill under a post-op, so I may say the patient is going to pay a copay today of $20, but I put the post-op charge in on my first line item, the unapplied will never come over to a charge that has a less of a value or 0 than what you've actually collected. So again, it doesn't know what to do with it, so it leaves it at unapplied. So with that happening, the next thing we want to do then is you're actually manually out there looking all the time and you're checking and saying, okay, well, I'm moving, I go, this one the charge is not here, this one the charge is here and it wasn't moved. So anybody that's working the unapplied, I mean, it's a very, very manual process and it's approximately 6 to 8 clicks to move the money to unapplied if it doesn't come over during charge entry, and that's for each one. So what we did was we created an unapplied utility, and basically the key features of the unapplied utility is it's going to go out and check for a balance mismatch issue between transactions and bucket allowances. So if I've got a discrepancy here where I've got an encounter that's got some mismatched transactions, some $10 on one, some credits on the other, the unapplied utility is not going to move that. We're going to actually, give you visibility to that and let you go out and correct those. One of the other things that we don't want it to do is we actually don't want it to look at some of the positives and negatives that are counterbalancing on different charge lines as well too. So again, we're going to give you the ability, if I've got credits on one and debits on the other, we don't want it to just start moving money all over the place. It does avoid encounters with unposted transactions. So we don't want it to go ahead and post on a transaction where somebody else has already moved that unapplied over and just hasn't closed their batch yet. And this unapplied utility can be ran on a SQL, a select query, or we can go ahead and set it up that it actually just works in the background for you. So those are a couple things that it does and it doesn't do. So one of the things we want to get into now is what does it actually do then as well is create the unposted batch. Okay, we can do this per practice or we can do it multiple practices if you have multiple practices in your enterprise. It gives the ability for the supervisors or your team to go in and look at everything that's being moved over. So it's not going to just move it over and not have somebody still open the batch, look at the batch. You can glance through it and make sure that it's actually doing exactly what you want it to do. This unapplied utility can move balances from third-party buckets to the patient balances. And what this does is when I said that we forget to say that the patient owes a $20 copay today, so it's going to go out and it's going to say, okay, I have $20 here, and I'm going to go out and look if there's a patient balance of $20 on this encounter, I'm going to move it. And if there's not, then it's going to go over and look in insurance bucket 1, and it's going to take $20 of that, push it to the patient balance, and then post the unapplied to it as well, because that is one of the biggest reasons why we see the unapplied money still sitting out there. But when that occurs and we actually take money from the insurance, move it to the patient bucket, there's also a note that's going to be created for documentation to show there was no patient balance on this encounter. We grabbed the $20 from Insurance 1 and moved it to post the unapplied. And I did mention that we can run this for a single practice, a group of practices in one path. The unapplied transaction codes are read from each practice's settings, so if you have multiple practices and they use different transaction codes, we can set that up as well. The charge balance selection prioritization. With the unapplied, there's a couple of things that you can tweak for your practice specific if you want, but the way it's going to look at it, it's going to go out and say encounter unapplieds are only going to be posted to charges on that encounter. So we're never going to take an encounter unapplied and put it out to an account and then move it to a different encounter. It will always go encounter to that very specific encounter. Patient balances are always have the priority over the third-party insurance balances. So again, we're going to look at that balance in the patient bucket first and then go grab an insurance balance if there is one. Balances are always going to be selected from COB order. So we're going to take money from primary first, but if there's nothing in primary, then we're going to look at secondary if there's only a balance within secondary, and then so forth. Account unapplied balances, the process is going to select the oldest encounter and post that. Now, if you choose not to post any account unapplied balances through this utility, you have that option as well too. A lot of practices are using account unapplied. Technically an error. You want to be really careful about what you're using account unapplied for, and if your staff just needs to be retrained to always use encounter unapplied, that's what we recommend first before using the utility. And then what's out on the account should be, free game to go ahead and post on your oldest encounters and start paying off those balance. But if you're using account unapplied for prepayments, you want to make sure that that's not just going to get grabbed and paid off on old encounters. So if you're unsure what you have in your unapplied right now, and you've never had a chance to go out look at it, you're not sure, you think it's all been moved over, first thing you want to do is go out and run your unapplied report, and it's just a simple accounts receivable, unapplied amounts by account. Now if you're on UD1 currently or any version older than that, you're going to get a report that's going to give you an account number or an encounter number. You can pull by rendering physician, and then it's going to give you what's in unapplied. You will not know whether there's a charge out there yet without drilling into it, and like I said, going about 6 to 8 clicks into it. Anybody that's on UD2, you are able to now see that there's a charge out there, but for you to move it, you still have to 6 to 8 clicks into it and grab it and then post that unapplied. So go ahead and run your report and know what you have out there. Before we jump into the iCare server, a couple other things I wanted to mention was, you may have a great handle on your unapplied. You may be moving it and have staff working on a day-to-day basis, but take a look at how long it's taking your staff to move this money over. It's a great utility for that. And one of the things is I do like the front desk staff to be accountable for their own money they collect. It's a great way to put it out there and not applied, but many offices have had struggles with, it's out there and it just seems to get lost out there, and, we move them over and then I go back and there's one that's, 6 months old and I've sent a patient 4 statements and their money was sitting out and unapplied. So two-part, if you don't move this money over quickly, you're going to be sending out statements to patients who have already paid. So then you're paying, to send out a statement for a payment that you have in the system that is not just efficiently being moved over to that charge once it's entered. So before we move into iCare, is there some questions?
There are. And first I actually wanted to clarify, we've got a couple of people asking if the auto enrollment is related to the unapplied balances. These are, and iServer Health, these are all 3 separate offerings that we're here to tell you about and help you with, and they're not related and they all can be implemented individually. Okay, so another question, Jeannie, can you please repeat why the system cannot apply the payment?
There's 3 reasons why, so back on the slide, and you'll get a copy of the slide. The 3 main reasons is the first one is if I don't have an active batch when I'm entering my charges. See, although I'm not collecting any payments at that moment, if I don't have a batch open, it will not move over my unapplied. So even just to be moving money from unapplied to the actual charge entry screen, I must have a batch open. And many staff members, charge entry people just don't, they think I'm not dealing with money, so they just don't open a batch. The second one, and the biggest one that we see across the board, is really the encounter copay. That if I collect that, I need to actually tell the the system, I've collected $20 for today, I put it in the $20 copay, and that's what actually then allows the money to just nice and clean, you know, when I post the charge, it's going to say, oh, there's $20 in Unapplied. I have a $20 patient balance. I'm just going to move my $20 on there. And the last one is the first line item. If the first line item is less than what I collect in copay, so even if it would be a urinalysis and it was $15 and you collect $20, it's not going to post the 20 because it's not going to create a credit on that line item, so it just leaves it out to Unapplied.
Thanks, Jeannie. And it looks like one more question related to this. What's the difference between the ENC copayment and entering the copayment amount in the copayment box?
There's one that's going to be on there that's going to be just chart, and I mean, encounter copay is how much does that patient owe today. So ENC copay is how much am I collecting, or how much does that patient owe for today's visit. The other one is actually just your copayment, and that is really just what is their copayment on a regular basis. So once you look at the card, you put that in there and you'll put $20, but that will never move down to the encounter copay. You always still must enter the encounter copay on each visit, because there could be visits where they come in for a very specific test that no encounter copay applies for that day. So by encounter specific, every single encounter you must enter whether they have a copay today or not.
Okay, thanks. So Keith, I think that we'll go ahead and hand it off to you, and you can talk a little bit about the iCare Server Health offering.
All right, thanks, Chelsea, and thanks, Jeannie, for that great presentation. By the way, I thought I'd mention the whole reason why that utility came to an existence is because I think when we were working with some of our clients, we were just stunned at some of the balances that were out there at our clients and how long they were sitting out there. And it was just, you know, somebody came to us and said, you got to help us figure this out. And after we did it, we realized how important this was for other practices. So we started making it available as a solution for anybody. But we were just stunned by that kind of stuff. But okay, so now when we move on to this next piece of making NextGen more efficient, let's not get carried away by the title of, you know, server health. People start hearing the word server and they think I'm going to get real technical and real detailed and get into server technologies and stuff. So don't everybody start jumping off the webinar yet. I will get into some specifics here, but I think I'm going to try and put a twist on this to kind of give you the business perspective of why this is important, even though there is technical reasons and technical things under the blankets that we're doing to make sure that NextGen does run efficient for you and your environments. So what is iCare Server Health? It's basically a unique monitoring, alerting, and remediation service that's crafted specifically to ensure the availability and performance of your NextGen healthcare environment. And you know, this came to fruition because we heard a lot of people complaining about performance over the years, and that's such a loose term. It could be anywhere in your environment. It could be in the network. It could be at the individual workstation. It could be in the servers. It could be in the database. And so we had to get our arms wrapped around this as well to try and figure out how can we put together a solution that looks at the whole overall environment so that when somebody has that complaint, we know where we can begin to look for this stuff. So that's why we spent some time putting this together. So we needed a solution, again, to expand a little bit more on this, we needed a solution for our own hosted clients because we understood more than just basic Windows and hardware monitoring. We needed to understand the NextGen environment. So we wanted actionable alerts that mirrored performance or availability issues that impact your end users of your PM and EHR. We wanted to economize labor by automating some of the remediation anywhere possible that we could, and then we wanted to resolve issues before they impacted our users. So it's critical. You don't want to get the call where your end users calling your IT department saying, hey, this thing's, you know, something's broken or we can't connect anymore. Hopefully your IT department knows that ahead of time and is already working on it. That's the way it's supposed to work. Okay, so does any of this stuff sound familiar in your environment today? Does your online document processor not processing, or offline document processor, communication services not communicating for your patient portal and some of your other comm services? Is the health quality measures not measuring? Does your report server not reporting and doing what it's supposed to be doing? Is the SQL server not serving up? Is it dropping, or is it performing horribly? And then what kind of performance issues are you having on your network? So this is how it works basically. We install non-invasive agents on your servers, and we use a product called LabTech. We're just going to tell you right what it is. That's LabTech software. We vetted out several solutions out in the market. This is an industry standard or a top tier vendor out there that we selected. And so we look at the server operating system level, we look at performance counters, services, queues, we look at the SQL Server platform, we're looking at performance counters there as well, we're looking at specific SQL functions. We've written custom SQL scripts ourselves to look at specific NextGen functions. And I think that's where you're going to see the power in this presentation, is to see what we've done to look at the NextGen environment. And we also have custom application server scripts, and these are specific to NextGen functions, but then we understand that every environment is different out there, and you might have some specific interfaces or specific things out there that are just unique to your environment, and so we can custom build those scripts to look at just those specific interfaces for you as well. And then the all-important part of this is not only are we watching it, but we want those alerts to trigger communications or do some automated remediation as well. So here's some of the things we monitor just at the first layer, which is the Windows monitor. So we're looking at services and processes. We're looking at memory paging. This is kind of a little bit of the technical type stuff here. We're looking at processors on the computers, user counts, terminal server load, that type of load balancing going on there. We're looking at storage, SQL Server specifics, files and directories, print queues, schedule tags, that kind of stuff. But it kind of goes without saying here that your server and network infrastructure is the backbone of your business. Interruptions are costly to productivity and distractions, and your IT departments are responsible for ensuring the uptime and performance. And it all starts at this layer. I would say a majority of the monitoring issues that we get alerted about really aren't at the NextGen platform layer. They're really at the Windows layer, or the load balancing of servers or storage or SQL stuff. And so you have to make sure both of these layers are being watched. So from the advanced monitoring standpoint, from our NextGen monitors, we're looking at ICS. These are not in any particular order. I just kind of threw them on here and as what came off of memory of everything we're looking at here. But so we look at ICS scanning. We have a script that looks for images that are registered to the database, and we're looking at it between 1 and 7 days ago, and upload, and then it generates an alert. And the reason you want to do this is we found, in many cases, where these images are orphaned out on these stations, where for some reason it just didn't get put up to the database. So it got registered to the database that there's an image, but the image didn't actually make it up there, and they're all orphans and sitting on PCs. And we want to make sure those things are up there and getting scanned and getting backed up and all that stuff. So that's the important thing with your scanned images. So on interface monitoring, we have a script that looks for 10 or more orders not being processed successfully within the past hour, or any inbound failures in the last hour. And obviously you want your interfaces working, especially your lab orders. You need to make sure those things are going out. E-prescribing, you need to make sure those are going out as well. And so we're constantly watching that queue, just looking to see if there's anything larger than 10 items in that queue. And these are all customizable. If you want it shorter than that, we can make it shorter than that, or we can even do it more frequently than an hour. From an OLDP standpoint, we have a script that looks at pending and failed requests, as well as requests no longer pending but not complete either. So it's obviously want to make sure that these things, the document process, are being done in a timely manner, and make sure that the systems are getting what they need. So we want to look at this stuff every 10 minutes to make sure there's nothing pending sitting there. From a report health monitoring, this is a fairly simple script, but it looks at recent updates to the report server, and it runs once a day, and we just want to make sure your report server is kept up to date with the current date from the previous current data from the previous day, so that you're doing your reporting off of current information. Some other NextGen monitors, the Windows event log. We've done something pretty cool here. I'm really kind of impressed with some of our engineers here. We've looked at event logs that Microsoft has, and looked at log numbers. They're functions, basically they're event IDs that weren't being used by Microsoft, but they were kind of lingering out there and available. So we generated our own. And so just about everything we monitor, we have the monitoring scripts create an event ID and then post it to the Windows event log, so that we can scan that and pull out and review and create our alerts. But so it's logging the event there, plus it's pulling the data, doing the scanning, and doing the alerting, and in some cases remediation. So we got it going on in multiple places. But this is really slick to be able to create your own event IDs to tie them to specific NextGen functions. The background business processor, obviously we want to integrate integrate the background business processor error messaging into our ticket system. So BBP already has a pretty slick process in place already, So we didn't really have to do anything specific or unique to monitor that because that's already there, but we just wanted to integrate it and make sure that it's doing the correct alerting and notifying into our ticket system. Template cache is another place. Some people cache their template stuff locally, so we want to make sure it gets copied over and monitored that it is being successfully, so that way it speeds up just like you're using your template stuff when you browse the internet. The same thing goes for your templates. We want to make sure that cache is being backed up, so we're monitoring it and make sure it's being logged in the right place. We have nightly and weekly SQL jobs, and those have various job statuses at different times that we're looking at to make sure those backups are being done correctly, and the cleanup jobs and the file maintenance type stuff is all being done correctly on the SQL Server environment. Pseudo interfaces, those are things like FTP and WinSCP. Those are just things like if you've got some interfaces where you're transferring data up and down from a third party. We just want to make sure those our scripts are watching those to make sure those are successful. And then our custom scripting, which is kind of everything left over. That's your things that are unique to your environment that aren't across the board for all NextGen users, and believe me, every NextGen installation out there has its own unique environment. So there are certain sections that we'll just write custom scripts for you to make sure that we're covering all your bases for you. Okay, so when it comes to alerting, we got a couple different solutions here we work with. Obviously, we can do notification via email. We can escalate it via email as well if you want us to go to multiple locations. We've also, for some of our clients, we've integrated it to our own supporting ticketing system for remediation. So you can send the alerts to us if you want us to handle some remediation for you. It just comes to our ticketing system instead of your own internally. If you just kind of basically want to outsource it and hand it over to us. Another option that we have that we've used before is some practices we've come across don't have their own ticketing system for their own IT department. And so what we've offered to them is just by a simple license, we can give you a license which is basically an extension of our own ticketing system, and so the alerts can go to that ticketing system and you can work on those, your own IT staff can work on those just as if it was your own ticketing system. And then if you wanted us to handle any tier 2 or tier 3 NextGen issues that you thought were beyond the skills of your staff there, it's tightly integrated right into our own ticketing system, and so just with a simple escalation you can drop it right into our queues to help you. So that interface has been well worth its it's got a great return on investment for a couple of clients of ours that just bought the license and then integrated it right into our ticketing system, and now we work together closer as a team to help resolve those issues. Okay, so as I mentioned before with our custom scripts, we understand that there's one solution. I mean, while we can pretty much pick this up and drop it into your environment, it's not going to cover everything because everybody's got some use going on. And so basically, this is why it's completely customizable to your practice needs. We have custom monitors, we can customize alerts and escalation, and you can even have a customized remediation plan if you want to handle it yourself or escalate it to us. Some people do a time and materials basis and just have us fix them when they need them. Some people like to work on a retainer, gives them a little bit of higher priority and higher visibility into our engineering staff. There's different ways. It's all custom. We can work with you either way. Okay, so from a remediation standpoint and from a preventative perspective, so at a minimum, anything that is a service in the environment here, we will set to automatic and auto restart any services that are involved at the SQL layer, the operating system layer, and the NextGen layer, from the application standpoints, interfaces, all that stuff. Any of those services that we find having issues, those will always be set to auto restart. There's a couple things we're working on right now, specific functions where we'd like to auto remediate is OLDP and then specific interfaces. Those two are in our development right now so that we can take care of some even more auto remediation and not have to get people involved. And then there's manual remediation assistance. I mentioned that earlier, where we can do it on time and materials basis, or we can do it on a retainer, whatever works for you folks. Going a little bit step further, because we do use lab tech as our solution, we can offer certain things that are even better than just the infrastructure layer as well as the NextGen layer. So we can even do Windows patch management if you want to do that for your environment, where we can look at missed patches, we can apply approved patches or apply updates. We can provide quarterly reporting for you from a server statistics standpoint as well as the health of your environment from a server health standpoint. There we go. Okay, so why do practices choose this? And I thought it was really interesting because as we've sold more and more of these, this monitoring or this iCare server health for our clients out there, it's interesting how we hear some of the people give us their reasons where they're not always the same. Like some of the more common ones is not every practice has in-depth knowledge within NextGen under the hood, and they don't really know what to look for. So basically they do kind of the underlying layer, or maybe they do just the you know, the entry-level point of what NextGen offers, which is their wellness NextGen WellCare, I think it's called WellCare, which is a good start. It is a good start. We've just taken it a lot further and added some more features to it and look at it really in depth. Maybe your NextGen staff love the capabilities of the auto remediation with some other customized scripts. Practices just don't want to deal with it. We had some come to us and said, you know, we want somebody that we want to know somebody else is watching this and taking care of it for it. We just want you to, you know, we want to wash our hands and just put it in your lap and let you take care of it for us. Another reason was we're just tired of keeping up with the changes in NextGen from a technology perspective. Every time there's a UD update or some change or a massive upgrade, they have to go in and relook at everything and look at what's changed in the application, and this becomes our responsibility. If you have this service from us, it becomes our responsibility to make sure we're keeping up with all the changes in the environment. They want confidence that someone else is watching this for us. I think I just mentioned that a little bit ago. These tools are already custom built with industry standard software to monitor the environment for you, and it's kind of soup to nuts everything from even that patch management stuff to the Windows layer, the infrastructure layer, as well as the NextGen layer. Some person came to us and said, we trust you guys because you've been around since 1997. We're the first group to host NextGen. If you don't know it better than anybody else, who would? So they just take care of this for us because we know that you know what to look for. And then another group came to us and said, you know, keeping your system up and performing is just as important to us as it is for you. Okay, so what's your next step with us? We're just about ready to wrap this up here. You can either email us or call us. We'll have some contact information at the end of this presentation. You can feel free to reach out to me. We can develop some of these scripts for you just on a time and materials basis. We can help you do that if you want to keep it in your own environment, or you can just hand it over to Itentive if you want. Just let us manage it for you. It's very simply priced per server monthly. It's pretty easy. We got a promotion going on right now. It's $30 a terminal server and $90 an application server per month. And then you could consider a relationship with us if you want us to do remediation. So that handles all the monitoring and all the alerting, the pricing per server per month. But then when it comes to the remediation, you get to decide how you want to do that. We can send the alerts to you. You can integrate it with our ticketing system. You can have us do it on a T&M basis, or you can have us set up as a retainer. And then, as I mentioned before a couple different times, the custom script development's just on a T&M basis. The next slides, I'm looking at our time right now. Here's what I'd rather do. The next few slides just basically talk more about Itentive, but I'll tell you what, you can jump out to itentive.com and get a lot of the same stuff too. So I'm going to go ahead and turn it back over to Chelsea and open the floor up and let her, because there's only 15 minutes left, and see if there's any questions about anything you've heard so far, from the auto enrollment to the unapplied balances to the iCare server health.
Thanks a lot, Keith. So again, you can type any of your questions in the questions area of the webinar control panel, and we'll answer those in the order that they come. And so the first question is going back to Cindy from the auto enrollment portion. Can you make it automatic that forces users to change their password?
Yes, in fact, it is automatic. I should have clarified that going through it. That is something that is required. It's a generic password, much like you get with, when you're enrolling in a lot of other things. It will force you to change your password when you go in. The initial password that they get will not be the one they keep. It does not force them to change their username, but it will make it force change that, and I believe we can make it force to change their security question as well.
Great. Looks like we only have one other question right now. So if you have a question, type it now. Otherwise, feel free to reach out to any of the people that you see up on the screen, or reply to me. I'll be sending out a link to the recordings and the PDF later this week. So, and that was actually the question, can I get a copy of the slides? Yep, we'll be sending it out. So look for an email from that. Occasionally, for some reason, it tends to end up in people's spam folders. So if you don't see it by the end of the week, check your spam folder, and it's probably in there, or else feel free to reach out to any of us. We'd be happy to send it to you individually as well. Don't forget to follow us on Facebook, social media, LinkedIn, Twitter. We do weekly tech tips. You can always ask questions there. We're happy to help in any way that we can. And thank you, everybody, for joining us for today. We'll hang on just a couple minutes longer if anybody has questions. Does anyone else have anything to add?
Yeah, actually, this is Cindy. While we're waiting on all of these services, if you're questioning how you can do them or how they benefit you, we can actually reach out to any one of us that are on the questions list, Keith, Lindsay, or myself. Lindsay's not on the webinar today, and we can get back to you with testimonials, let you talk to people who have used them, particularly some of the ones that maybe seem a little bit foreign or a little bit scary, particularly like auto-enrollment, or if you're going to let the system do your apply your unapplied and those type of things. We can let you talk to people, and even some of the people who were involved in the initial ways, because there's all, in those two particular services, as is Keith mentioned in his, I would say even with those, not two of them are alike. Everybody has a different idea of how they want to manage these things, and there's a lot of configuration, a lot of setup that you can do. So it's not just a one-size-fits-all, and we'll be happy to take you through it.
Jeannie, do you have anything to add?
Nope. Actually, if anybody has any questions, you can reach out, like I said, to anybody on the list there. You can reach out to me. We have actually ran, the Unapplied on multiple clients. We've ran it through in their develop or their test environment just to give them a little bit of hands-on of looking at, how it's going to function for them. But if you have any questions on that, please reach out to us.
Keith, last thoughts?
Well, I can go ahead and take another half an hour and get real technical.
Well, I know you could.
Yeah, Chelsea.
I don't think I will. But we have rolled this out in several clients, so if anybody wants to, we can give you references, and we can also, show you how it works. That's not a problem.
Great. Well, everyone, thank you for your time today, and I hope you have a great rest of the week, and keep your eyes out for an email from me with the slides, as well as a recording to next week's webinar on the educational webinar, an educational webinar on HIPAA texting do's and don'ts.
That's one thing I did want to ask.
Oh, yeah.
Chelsea, yeah, there's one thing I wanted to add for those of you that are still on that HIPAA texting. We're going to be really looking at that in depth. I've had a lot of our clients that we work with that have had that struggle with their providers and even internally being able to text. And we're going to be offering that in two sessions that day. So we're actually going to be doing a late afternoon, evening session, depending upon your time zone, so that you can have your providers attend if you like. We've had some requests for that, and that was one that I felt would be really, really good for the providers. So you'll be actually getting 2 time options on that particular webinar.
Oh, yeah, that one we're going to be doing an afternoon as well as an evening, because that one we think is going to be very popular. So definitely keep your eyes out for that one. Okay, everyone. Well, thank you so much, and have a great day.
All right. Bye-bye.